Um, so we want to hear from Dr. Shukesh. Dr. Shukesh, I get to know him by other like a very good friend of mine, a big brother of mine. So once Dr. Shukesh bhai called me, right? You called me in
Yeah,
my number, and we have talked, and he had the doubts like he has a big gap previously, and he was doubting like what he can do. And this will be like, motivating for all those candidates who are like, rejoining in the studying and giving this MRCS and all that stuff. I am pretty much sure that Dr. Shukesh Bhai's story, this will motivate you guys. That's for sure. All right, Dr. Shukesh Bhai, it's all yours. I'm so much happy, and a big congratulations for your success. Okay. So the
thank you.
floor is yours. The time is yours. Go ahead.
Yeah, colleagues, hi, good evening. Let me introduce myself. I'm Dr. Shukesh Thakur. I'm a senior specialist surgeon working in government sector in United Arab Emirates. Actually, I passed my post-graduation in surgery back in 2007. After that, I worked in a medical college in Mumbai for almost more than 10 years. And then in the year 2021, I left my position as associate professor in a medical college, and for some reasons I moved to Middle East. And gave my first attempt for part one, doing my work, doing my job in 2019, where my result was withheld for some reason. And after coming here, I found that my academic growth is just withheld for some reason, for some personal engagements. Then I decided to appear for MRCS because I wanted to move ahead in my career. So I thought, and I was been given a lot of encouragement from my colleagues, as per Dr. Atiq sir said. He is Dr. Samir, who is one of the good friend of mine, and we practice together that I should appear for it. I also encouraged him. Luckily, he got both the steps in a very quick go, and he moved to UK. So I reappeared in part one in 2024 Jan, and my center was Abu Dhabi here. And with God willing, I passed the exam with a good marks. And I did not want to put any gap in further doing part B, as I found a lot of candidates lose interest in studying, and then they just part one, they don't proceed for part two. Maybe for some reason. Then I got the reference of Dr. Atiq sir through this friend of mine, Dr. Samir, and I contacted Dr. Atiq. He welcomed me, and he allowed me to join his group. So I'll just briefly tell you that I joined the group in the February 2024. I regularly attended the sessions and regularly attended the mock. And sometimes, because of the engagement in the work and all, whenever possible, I was able to participate actively in the mock. So that is one point that I found, that knowledge is one thing, but inhibition is been lost. Like, you have an inhibition. Yeah, if I participate, if I say wrong, there are 20, 30 other people, they will laugh, and so many things that will be lost. And everybody has some kind of a, spirit, and some kind of inner powers that I feel, everybody. So that comes out, and the person starts speaking, he realized that I should modify this way, and I should add these things. So I think participation in the mock is a very important thing. So, and I can see that Dr. Atiq is taking very special efforts to take mock. He allows all the interested candidates to participate. Sometimes I found that in one topic, he allowed two candidates to participate, so that nobody should be felt that he is left apart. So that is the best part of it. And third thing, that I regularly started studying from the 1st of June. I will not say anything that I did not do, but I was studying like very harshly, like maybe 7 to 8 hours a day. In a hospital, I requested my seniors, my colleagues, that whenever I have some time, I will sit in the library and study. So one part I found difficult, little difficult, which Dr. Atiq sir has made easy, is anatomy, because anatomy is nothing like concept and all. You should know this, yes or no, and it is possible. So I focused on anatomy and critical care, as well as pathology. And I will be saying frankly that I revise for at least 10 times everything. And only problem was lacking is communication station. In last 1 month, I put special efforts for communication station with a partner. Now here is the click. In communication station, many times we think that, "Arey yaar, ye to bahut easy hai. This is very easy. Putting the catheter is, I did it maybe more than 10,000 times. What a big deal." But they want the way they expect. Simple, I'm telling you, because catheter, I have seen so many places, catheter is been put by ward boys and the staff nurse. But the Royal College wants catheter placement. I'm giving catheter placement because this is the most common thing we do. Catheter placement, right from internship, studentship. But the Royal College want that in a specific way. So you want to adopt yourself into a special way while practicing in the hospital. That's what I came into conclusion, that if somebody told me, "Okay, doctor, can you put the catheter in this patient?" So I will follow not my old practice. I will follow what Royal College wants from me, like introducing yourself, washing hands, asking for saffron, explaining the procedure, explaining the WHO surgical checklist, and so many things what Dr. Atik sir told you. But everything that is important, and that if you don't follow in your hospital, I don't think you will be able to remember anything in exam, and you are going to do mistakes. So that is going to happen. And this is the thing, and a very, very important thing that I realized, it's QRC group. QRC group is one where I actively and aggressively participated. Aggressively. Why? Because I was repeatedly requesting, "Okay, let me participate," and they allowed me. And there I lost all my inhibitions, all my drawbacks. So in exam, for exam, I'll just briefly tell you that my exam was in Penang. 18th of August was my exam day, and Penang is in Malaysia. So on 14th, I started from here. I took official leave from 1st of the August, and on 18th, 14th, we flew from here, one of my friend and me. So 14th evening we reached there. So on 14th we were not able to do anything because it was a jet lag and we reached late because of immigration and all. But on 15th, we visited the center. 2 days, 3 days prior to the exam, we visited the center, saw how far away it is. And then 2 days, because, a lot of people say, we don't study, we relax, we listen to the music. I don't think anything of this kind of happens to anybody. Everybody wants to see something. Let us see some diagrams. Let us see some, some things we are forgetting. So that thing even happened to me. And I had a strong belief in God, and a lot of prayers I did for myself and everybody who are my colleagues. What things that mattered in my exam, I'll just tell you that good prayers, good sleep, average breakfast. Very important is your dressing. Your dressing should be very professional, because so many people told me that you are appearing for Ireland, and Ireland people are very harsh, and Ireland results are not good. So I said, now I have booked my exam, and to be frank, I requested my wife, my colleagues, taken their opinion, let me postpone my exam. I am not well prepared. Everybody said, no, 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 you should go ahead, because ideal study will never happen. And even I wrote to Royal College also. They said, no, no, the closing date is already over. You have to, you will lose all your money. So I thought, okay, now I will give my best trial. So professional dressing is very important, right from the shoes, half shirts, and everything that I found. Your clean shave, your smile on the face, passing and failing. I think that is one thing, but you are going to appear to a patient rather than an examiner in communication. So I think that thing matters. And even examiners also sense you, that how professional you are. So that matters. And smiling face, and these phrases I found I use too much. Hello, please, sorry, may I, excuse me, thank you for your valuable time, and I will come back to you definitely. You are in the best hands. Don't worry. If the patient say, I will die, or my relative will die, so say, don't worry, we will do the best. So all these things matter. I had a problem with 3 stations, Dr. Atik. And problem with the station is not an issue. The problem is that when you come out of the station and you realize that you have done mistake, it reflects on your next station.
Correct. Yes. And that's why,
Yeah.
like, during the mock sessions, I used to say that you always need to wash all of the things that happen into your past session, and you always have to go for a fresh start, right? Because those things will inside of your mind that will be recoiling again and again. You cannot go for like with those emotions, right? So that's why you
Yeah.
always need to go for a fresh start for a next station, always.
For me, this happened in 3 stations. That my stations
Mm.
were little average. I was not able to answer a very
Hmm.
common things. When it came out of the station, I realized that this is so simple answer, and I was not able to
Right.
answer. And in communication stations, time management was little tough because examiner was behind me. Okay, finish it. Let me ask you some
Mm.
questions. And I was with the patient and all, so I was not able to. So what I suggested, as you always tell us, that 5 minutes is the standard time. In 5 minutes, you
Yes.
finish with the patient, and 1 minute for presentation, and give 4 minutes for them, because this time is important when you will able to interact with the examiner.
True. True. You need to
So
show off.
yeah, this things influenced on my next stations. But the
Right.
best thing is that my anatomy stations and my all I mean anatomy and critical care stations, almost they finished in 6 minutes, and the examiner and me
Hmm.
are just watching each other. All the questions I answered. So that
Excellent.
was a good thing that happened. And one good thing also happened is that after I explained to a splenectomy mother,
Mm.
the mother of a splenectomy patient, everything. When I went outside and was waiting for my turn to next station, the examiner and the common person sits with the, I think, examiner to assess you.
Hmm.
Both of them asked the patient, this dummy mother, that how is this candidate. She said he is excellent. So then that thing
Mm.
boosted me for next 5 6 stations,
Right.
because
Right. This
I
is too important, like
yeah,
if you know that or not, in one of the sessions I said, like in some of the communication sessions, especially in the communication with person, that some of the candidates, some of the patient is going to mention that, okay, I'm in a very safe hand, and they're going to smile at you, right? That's the time, okay, my exam was a very top-notch exam, and I'm going to pass this exam, right? And that's the boost that you're going to have for the next few of the stations. Alhamdulillah, that happened with you. That's excellent, Dr.
yeah.
Shukesh.
The reason being, I made myself. I thought I will take exactly 10 minutes. I will not spare any minute out of this. I took a
Mhm.
paper. I took a pen. I explained her
Mm.
what is spleen in her language and so many things.
Right.
I said I am not in hurry.
Hmm.
So these things are there, and what I found, Dr. Atik, that recalls are very important, because what I
Mm.
found in my day,
Mm.
exactly Cairo stations from A to Z are repeated.
Right. Right.
From my station, next day, all the examiners, I heard that they went to KL, and the same stations were repeated, exactly
Mm.
A to Z same stations.
Mm.
So as you always suggest that go to the recent stations and all, I think that matters.
Yeah. Yes, brilliant. Okay, Dr. Shukesh bhai, it was an exceptional journey that you have passed your MRCS Part A in January, and you passed your Part B within this October. It's brilliant, isn't it? It feels good, right? It
I feel
feels
good,
good.
but I thought that I just walked a path which you already laid down. So that was so simple. I had to just walk.
That is just your kindness, Dr.
You have
Shukesh.
taken
You
efforts, and
you
I have.
No, no, it's just your kindness that you're saying like this. But the efforts that you have made, the time you have given for this, the amounts of mocks that you have attended, right? All of those things, who did that? You did that, right? So it's all your hard work. It's just all your hard work. And I'm so relieved. You know why? Because I had made a promise to you, right? That
Yeah,
I'm going to make you pass,
yeah,
correct?
I remember those words that you told me.
Yeah. Yes. So that's why I'm so much relieved. So it's
Okay,
a
okay.
it's a brilliant thing. So I kept myself silent while you were talking because you are a meticulous person that I know. Whatever you do in a meticulous way, stepwise, very, and even tonight, while you are saying your success story, it was so much meticulous. Like you have designed each and every steps and your words in that way so that we can be fascinated by hearing your success story. It was excellent, Dr. Shukesh bhai.
Thank you, sir. Sir, one more thing what I found is that your kindness helps you in exam. How kind you are towards your patient.
Yeah.
Because I found
Yes.
this thing,
Always.
they observe very deeply that how kind towards your patient, how you
Yes.
are polite towards your patient. Knowledge is one thing, but I think Royal College sees this thing. Knowledge you can able to achieve in whole of your life, but
Right.
your attitude towards the patient, that I want to make
Yes.
this patient, I want to help this patient, I want
Right.
to relieve of his
Right.
suffering. So these
Showing the
things,
empathy is very important.
showing empathy, plus you should have empathy inside, so that whenever you are
Yes.
practicing in hospital, either rural
Yes.
hospital or some tertiary care center, you should have empathy, you should have respect, you should have politeness. A lot of examiners, I heard, they are a little harsh maybe.
Hmm.
Various students have various experienced candidates, but
Mhm.
I think your politeness and your sympathy for the patient, that sails you through.
True, true. All right. It was very nice to hear from you, Dr. Shukesh. All right. It's time to hear some of the questions. If you have any queries, or if you just the same like Dr. Shukesh, that you have a very big gap and you want to restart your exam thing and all that stuff, please ask any queries. Yes, Dr. Jim.
হাই বন্ধু, কেমন আছো?
All well, doctor, thank you. ভালো আছি, ভালো আছি।
Oh, okay. I again congratulate you, Dr. Shukesh bhai. I want to share one experience. That is, Dr. Shukesh bhai was my study partner.
Brilliant.
So, so the thing is that I found him through IMG group. The thing I wanted to share is that Dr. Shukesh bhai exam was 18th of August and my exam
Mhm.
was 19th of September. So it was 1 month apart.
Mhm.
So we studied up to the last of the July, but in the end of the July, there was some instability in Bangladesh, and there was some
Yeah.
internet lagging off. So there is no internet in Bangladesh. So we
Mm.
couldn't study for the last 3 weeks maybe. So Shukesh bhai once called me, and he asked me how am I, how was Bangladesh, how is the condition. He told me one thing. He told me that, Dr. Jim, you don't worry. I will study with you after my exam is over. And you know one thing. After Shukesh Bhai's exam was over, after maybe 19th or 20th of August, he contacted me. He told me that, Dr. Jim, I want to study with you again, and I think you should study with me. So that
That's
was
why
so
I
much.
say Dr. Shogushbhai is so much kind. Even
Yeah,
why I'm saying that, I'm not joking about that, because once there was a mock for clinical examination, I can still remember, okay? Some
yeah,
of the
yeah. I
candidates
remember.
wanted to, yeah, some of the candidates wanted to perform, but there wasn't any patient. He didn't, or there was, I completely forgot who was that, but there wasn't any patient, and the candidates didn't arrange anyone else, right? So Dr. Shukesh Bhai himself become a patient.
He was my patient.
Right, Dr. Tasin, yes.
Yeah,
So,
ankle
yeah,
examination.
ankle examination. And he was doing like, he was just there for all the candidates, like removing his shorts, and like, it was so kind for Dr. Shukesh to do all of these things. That's why I said it's all of your kindness, that these nice words you are giving for me. It was brilliant.
I found all candidates are very good. Only thing is that never lose your confidence, because you have studied, so you will pass. Like.
Yeah, yes, yes. All right. Anyone else wants to ask any queries to Dr. Shukesh?
I think all the queries are been solved by Dr. Tahsin. So thanks, Dr. Tahsin. You shared all my work from here. Thank you.
Right, right.
Congratulations to you.
Congratulations to you, Dr. Tahsin, and all the successful candidates. And my message, who are not able to sail through this, this is a small journey. Today or tomorrow it will finish. So nothing like getting nervous and getting depressed. And I think a lot of candidates, I heard that so many candidates are doing the excellent work in UK. They passed in second attempts.
Yeah.
So I think this is a very small part of your professional journey. Don't get disheartened, but I think regular and sincere study is important.
All right,
Yeah.
Dr. Shukesh bhai, thank you so much for your time. I know you are a very busy person, and no matter what, once I'm going to in Dubai or UAE, wherever you are, I'm going to visit you.
Please, sir. Please, sir. I will like to host
Okay?
you. Definitely.
Yeah, you have
Thank
said that to me as well. All right, thank you so much, Dr. Shukesh bhai. It was brilliant talking to you again, and assalamu alaikum.
Walaikum
It was
salam.
very
Thank you.
nice. Okay. All right, we will be in touch.
Yeah, sure, sir. Sure.
All right.